Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
Who are the key players for program success? So what happens after I get a lung cancer screening test? What happens once I find something on my lungs that need further workup? So this is, I think, an important question that every patient and family member and caretaker should be thinking about. Is any center that you choose to go to for care needs to have all the comprehensive care available. It is not just helpful to tell somebody that they have a spot on the lung that needs further workup. There's a whole continuum of care that's involved. So most centers that have very good lung cancer screening programs always have a nurse or a coordinator who essentially follows the patient through the process and helps them make decisions and schedules appointments and helps them along the process of lung cancer screening. So you need somebody who's the point of contact for getting those CT scans, and a good primary care provider who's going to follow up on the results. And you need access to CT scanners. So you need radiologists who can interpret those CT scans. And then everything after that, in case you find a spot on the lung, you need a pulmonologist, you need access to a healthcare center that is not too far away. If you have an early stage cancer that's diagnosed, then you need access to thoracic surgery, radiation oncology, or if you need a medical oncologist. All of these need to be available in a very accessible manner for patients and their caregivers. So it's not important to just screen somebody for cancer, but we need to be able to provide everything that comes after. Another part of this is counseling and accessibility to people who can talk to you about tobacco cessation, if that is something you're interested in. A lot of patients, when they undergo lung cancer screening, also want an opportunity to help them with tobacco cessation. So having programs or being accessible to those questions is something that a good program with lung cancer screening would be providing.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelexis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.